This is Christopher Garcia. He is 13 years old and lives in Delaware. Let's begin our presentation by exploring and defining a topic that impacts Christopher's everyday life. Let's define in depth Christopher's disability. Christopher has cerebral palsy and dystonia. According to the Center for Disease Control, cerebral palsy is a group of disorders that affect a person's ability to move and maintain balance and posture. CP is the most common motor disability in childhood. Cerebral palsy is caused by abnormal brain development or damage to the developing brain that affects a person's ability to control his or her muscles. He also experiences dystonia, which is a movement disorder in which a person's muscles contract uncontrollably.
The medications Christopher used to be on to manage his symptoms include Valium, Sinemet, Ativan, gabapentin, Motrin and Tylenol around the clock, and an oral baclofen pump. The combination of high doses of these drugs over an extended period of time caused Christopher's organs to begin failing. Christopher's mother, Nancy, decided to explore alternative methods of pain management in hopes it would save her son's life.
So I had seen that video like in 2011, and then it just kind of stuck with me. Like I always had that. So when they were like telling, and I would tell Dr. Bean, his neurologist, like, oh my God, I need access to marijuana. Like I really believed that it could help him. And he would tell me, he's like, you know that it might not help him. I'm like, I know. But what if it does?
Yeah,
I'm like, and you know what? And then if it didn't, then at least I know that I tried everything that was in my possibilities to do for him.
Cannabidiol, or CBD, has similar chronic pain management as opioids without the painful repercussions. It is currently legal in Australia, Canada, Colombia, Germany, Italy, Mexico, Switzerland, and state by state in the United States. CBD is a non-psychoactive element of the marijuana plant. It doesn't make you high or cause changes in perception because it does not contain THC. Its benefits include stress and anxiety relief, pain management, reducing inflammation, and significantly reduces the likelihood of seizures. It is used in patients with cancer, epilepsy, and depression. Some states are hesitant to legalize medical marijuana because of THC, which disrupts the central nervous system and makes you feel high. It is often found in forms of oils and extracts, and you can buy it in the store because it is not regulated by the FDA.
As we previously said, CBD is legal state by state, but it was not always legal or accessible for children in Delaware. Riley's Law bridged that gap. Riley's Law made cannabis use legal for children. Riley is a little girl who had terminal cancer and experienced seizures that were improved by medical marijuana. Riley's Law covered medical marijuana use for pediatric seizures, but Christopher's diagnosis of muscle spasms would not have been covered under this law. This pushed Nancy to advocate for his diagnosis to be added to the register.
You guys should really express, because one thing that I have when I go to Congress, I do tell them that our kids need full access to the plant. Like they shouldn't be limited to CBD. And like many things, you're always so limited. Your zip code determines what you get.
The use of CBD oil for Christopher has opened his life up to new possibilities. Nancy's advocating for her son's health allowed her to find an alternative option to manage his pain beyond heavy drug usage. CBD oil allows Christopher to live a life with his pain controlled without the side effects of a cocktail of medications. He is healthy, active, and able to more fully participate in his therapies.
Remember this one? Can you get this one down here?
Get a butterfly. Get a butterfly.
Oh, I see you looking. Yes.
Yay, Christopher!
He can continue to pursue his passions, such as traveling the world, We had so much fun learning about Nancy and Christopher, and we are thankful for the time we spent with them.